Hello, Mike Jones, Fire Chief and Emergency Manager for the City of Fredericksburg, here to provide you another update on COVID-19 for the week of August 30th, 2021. Let's start a little bit with the numbers. We are continuing to see transmission in our community high throughout the entire Rappahannock region and especially in the city of Fredericksburg. The numbers as far as percent positivity remain around 10%. Today's totals from the weekend are at 9.8% positivity on the 7-day moving average. They've been just under 10% or just over 10% for better part of a week. The number of vaccines has increased slightly, so we have over 14,100 city residents that have received at least one dose of the vaccine. Those are people age 18 and over that we have information on. That equates out to about 58.1% of the population. We're still behind the state level, which now has about 76.6% of the adult population over the age of 18 with at least one dose of one of the vaccines. But we're still moving forward, and there are things that we need to do. Hospitalizations in the state are up. The number of people in ICU are up. In the local Rappahannock region, we continue to go either just below 50 or just above 50 number of cases of COVID-19 in our area hospitals. So again, the virus is with us, it's out there, and we need to do the best we can to prevent it. So how do we prevent this virus? The easiest and best way to try to do part of that work is to get the vaccine. If you've already had your vaccines, that's great. Continue to use the other methods that we'll talk about in a minute. If you've not had the vaccine, then please consider getting the vaccine. Whether you use a 2-shot method from either Pfizer or Moderna or the 1-shot Johnson & Johnson, they're all readily available. And they're all available without appointments. You can contact your local pharmacies or other areas, look it up on the Virginia Department of Health's website. There are multiple places you can go to get the vaccine and really without any appointments. So it's important to do that. If for whatever reason you suspect you might have COVID-19 or you've been exposed to someone who has a positive test for COVID-19 recently, then the best thing to do is get tested. And there are multiple testing sites around. Most pharmacies in the area can do that. Many of the primary cares can do it, as well as the urgent care facilities. All have the ability to provide you either an antigen test or, more importantly, a PCR test, which is the best way to confirm that you have or do not have COVID-19. All those things are important. So let's talk about prevention. First, get the vaccine if you've not already gotten it. 2, if you have the vaccine, if you're starting to get to the point where it's been 8 months since your last dose, consider getting a booster shot. They should also be available either now or shortly in the future. So check your vaccination card to see when the last time you had the vaccine was. 3, get together and look at wearing your mask indoors like the guidance provides. If you're going to go indoors or you're going to be outdoors in large crowds, consider wearing your mask. It's important. It helps prevent spread of the virus and protects you as well. So try to do that and make sure your friends also do that. Number 4, wash your hands. It's always a good measure to prevent disease by washing your hands thoroughly many times during the day. So all those things can work in your favor to try to prevent you from getting COVID-19. Let's hope with the vaccine, if you do have a breakthrough infection, that it's very minor. Most of them usually are, and a lot of them are asymptomatic. So again, vaccines are the way to help prevent the virus, or at least give you a better leg up from getting the virus, and making sure that if you have been exposed or you feel bad, get tested at one of the local facilities. We'll talk again next week. Thank you.